Okay, let's continue with our case scenarios. We just have a few here to kind of hopefully pull it all together for each of you. This is case scenario number 1. You're caring for a 26-year-old patient. She's a G1P1. She was in labor for 24 hours, pushed for 2 hours, and gave birth to a 7-pound, 7-ounce baby girl at 39 weeks. You put the baby skin to skin after birth, and the baby latched in the first hour for half an hour. Now her baby is 6 hours old. She's sleepy when you put her skin to skin with her mom, and she's not showing any hunger cues. She voided once, but has not stooled. The mom's asking you for help. Are you concerned in any way about this baby's feeding pattern? So if we look, it's a first-time mom. Baby's a good size, good gestation. She already fed once. She's only 6 hours old. She's still within that first day of life. She's already had one void. So everything actually looks beautiful here for this family. So there's no concern for this feeding pattern. What intervention, if any, should you recommend? She's already skin to skin. That's the number 1 recommendation we would make. So if, as long as mom's awake and enjoying her baby, she should be skin to skin. Baby can also do skin to skin with another family member if they're comfortable with that. Obviously, when the baby starts rooting toward a breast, they should be moved back to mom for feedings, but skin to skin with mom or dad or either parent would be fine. Any education you should provide to this patient? Again, we're in the rest and recovery mode, so just a lot of reassurance about what's normal on day 1. They both went through a lot. Baby's doing great so far, so just enjoy each other and snuggle and get to know one another. Number 2, you're caring for a 35-year-old primate. She was brought in for an induction. She's been laboring for 36 hours. She's being induced at 37 weeks for preeclampsia. She had a history of infertility and PCOS. After pushing for 5 hours, she needs a C-section for failure to descend. She goes back to the OR and has a 2-liter blood loss. She gave birth to a healthy baby who weighs 3,000 grams. In the PACU, he's put skin to skin with mom, but he shows no hunger cues at all. Are you concerned about this baby's feeding behavior? Again, if we look at his story, he's technically born before 38 weeks, but he's in the 37th week. He's a good size baby, so he's not terribly concerning at this point. Sounds like he went through a lot with his labor and delivery experience, so it's not surprising that he's not showing hunger cues yet either. So as far as the baby, the 37-week factor, he's someone to watch a little more closely, but it's too early to intervene in any way really for him. It's understandable that he wouldn't be interested in eating yet. What intervention, if any, should you recommend? So let's look at mom's story. She's a 35-year-old primate, so that's considered advanced maternal age, risk factor for low milk supply. She has a history of infertility and PCOS, also risk for low milk supply. She had a 2-liter blood loss, another risk for low milk supply. And now she has a 37-week baby who has not latched in this first golden hour of life, another risk for low milk supply. So she has several risks for low milk supply. So the intervention we should do is really to get her pumping. Again, if she's still in the PACU, it may be challenging to get a double electric pump back there. So don't forget the option of the manual pump, and even 2 if you need to, so she can do double-sided pumping. What education would you provide to the patient? I think I would just, in this case, stress the importance of pumping. If her baby's sleepy and not interested, give her reassurance that that can be normal, but pumping is important to stimulate a milk production. And she does have a lot of issues that put her at risk for low milk supply. I wouldn't necessarily stress those at this point because psychologically we don't want her to be discouraged right out of the gate. Let's give her an opportunity. Risk factors don't mean a guarantee for low milk supply. Plenty of women with risk factors make an adequate milk supply. So let's just focus on the fact that the baby hasn't latched and get her pumping so that she gets some breast stimulation, which is what we would do for anyone really to help them get off to a good start. This next scenario, it's a 43-year-old multip. She gave birth to a 36-week baby who's 2,200 grams. She's got a history of breastfeeding difficulty due to a low milk supply with her first baby. This baby's on the hypoglycemia protocol and the first sugar is 40. You put the baby skin to skin and they're not showing any feeding cues. She fed for about 5 minutes, but then she fell asleep on mom's chest. So what intervention, if any, should you recommend? Again, we have a multip, but she's AMA, she's advanced maternal age. She gave birth to a 36-week baby, so early and small. She already has a history of low milk supply. So for mom, the intervention should really be to start her pumping. As far as how often should the baby be eating, again, you've got a 36-week baby, 2,200 grams, so that puts the baby on the feeding plan for a less than 38-week SGA baby. That feeding plan recommends supplementing after each breastfeeding attempt. So this baby should be being fed every few hours based on the gestational age and size of the baby. In this case, do you want to supplement this baby? I would say absolutely you do. The baby is young and small on the hypoglycemia protocol. Sugar was only 40. Yes, she latched, but it was a short feeding and likely not effective given her gestational age and size. So the feeding plan does recommend supplementing. I would follow the feeding plan and supplement her for that reason. At least every 3 hours, she should be taking the volume recommended based on her age. Case number 4, this is a 30-year-old multip. Baby was born by emergency C-section for distress. APGARs were 2, 5, and 8, and the baby went to the NICU for continued observation. He started on oxygen and will have to stay in the NICU for at least 24 hours. The mom's C-section went well, but she's taken to the PACU and she's tearful. She's worried about her baby. How can you support this mother in providing milk for her baby? Again, they're separated. We know baby's going to be away for at least 24 hours. So she needs to start pumping, and she needs to start pumping hopefully within that first hour of life, treating it as the golden hour. Again, assuming she's in the PACU, you can consider using manual pumps if you need to. If you have a double electric pump available and you have space for it, that's even better. But at least get her a manual pump or two to start her pumping within that first hour. What education can you provide to help her while she's separated from her baby? Again, give her the encouragement that the best thing she can do is to keep pumping so that she builds a good milk supply. Any colostrum that you can capture while she's pumping can be sent to the NICU. Assuming the baby's taking feedings, they'll use it to feed the baby. If the baby's not approved for feedings, they can use it sometimes for oral care, or they can put it on a cloth in the baby's crib. So it's advantageous for the baby, whatever she can send down. Case number 5, you're caring for a 12-hour-old baby girl who was born at 40 weeks gestation. This mom's a primip and had a difficult labor that resulted in a C-section. The baby's 6 pounds, 6 ounces and never latched. Mom's starting to get worried about feeding her baby. So you put the baby skin to skin, but she's not showing any feeding cues. Are you concerned about the baby's behavior? Again, she's a 40-week gestation baby. She's a decent sized baby and she's only 12 hours old. Sounds like it was a difficult labor and ended up in a C-section. So that baby went through that difficult labor and C-section delivery. It's not really concerning or surprising that she's not ready to eat yet. She's not showing us any cues that show us concern that she's hungry. So we can assume that she's still doing okay. And given that it was a C-section, if she didn't get a good squeeze, she could still be spitting up or full of fluids. So no real concern about this baby who's a full-term, normal size, healthy baby. What intervention, if any, would you recommend? Again, the importance here is pumping. Baby's not latching, so mom should start pumping. It's been 12 hours now with no breast stimulation. So we should get her pumping. If you're comfortable or mom's comfortable, hand expression is also another great way to capture some colostrum, and any colostrum you capture can be offered to the baby. Even though supplement's not required, if you've got colostrum available, you can offer it to the baby to see if it gets her interested. What education should you provide to the patient? Again, just standard expectations for the first day of life. It's rest and recovery. It's trying and practicing. It's snuggling. It's not a lot of breastfeeding success on day 1. And this baby's giving us no reason for concern yet. She's only 12 hours old, good size, good age, and no hunger cues. So we'll just give her some more time and encourage skin to skin as long as mom's up for it. This is our last case scenario. This is a 20-year-old primip. Her baby was born last night at 40 weeks and weighs 8 pounds, 7 ounces. The baby initially latched well at birth and fed 2 times overnight, but with recent attempts, the baby latches and only sucks a few times before falling asleep. When dad moves the baby to the crib, she starts to cry, but then when the baby goes back to mom, she falls asleep at the breast. So the parents tell you that she's been doing this all morning and they're worried that the baby is just using mom as a pacifier. Are you concerned about the baby's feeding behavior? Again, she's 40 weeks, good gestation, good size at 8 pounds, 7 ounces. She latched once at birth and twice overnight. I assume it's still her first day of life. She was just born last night, so she's not 24 hours old yet. She has latched well, so we know she can do it. And even though she cries in the crib, she's sleeping when you offer her the breast. So she doesn't sound like she's showing us hunger cues necessarily. She's just crying. So I don't see any feeding concerns for this baby as far as her behavior. Education, what should we provide to the patient? Again, it's going through normal newborn expectations. I think this scenario is put together primarily for the fact that all the attention tends to be on feeding. Feeding is the only solution to what this baby needs. This is a brand new baby who spent 9 to 10 months inside mom's body and just arrived last night. So to expect her to comfortably and happily sleep in a crib away from her mom's body, it's a little early to expect that. And she cries in the crib, but yet when we offer her the breast for food, she's not interested in eating. She's happy just to be with her mom. So it's not a situation of her using mom as a pacifier. She's actually just looking for that warm body that she knows from her development time in the womb. So skin to skin, again, is an excellent solution in this case. I would discourage pacifier use because the baby isn't showing hunger cues, isn't trying to eat, and to just offer a pacifier, they may miss those cues when they come up. And this is not a baby who's showing you they need to suck. This baby's showing you that they need connection and skin to skin time. So mom and dad can kind of tag team that, and they can both do skin to skin. And if they're not interested in doing that, or if they're really just insistent that the baby needs to sleep in the crib, well, this is their baby, and they have the right as parents to decide how they want to parent their baby. And if they're insistent on a pacifier, after giving education about the risks of pacifier use and the need for the baby to be skin to skin, if they still want to use a pacifier, we'll give them a pacifier, but not without the education and encouragement before that. So those are our case scenarios. Hopefully they help bring it all together for you a little bit. This is just a closure slide to remind you that, parents really are, we've got that big initiation rate, 90% or better come in initiating breastfeeding. They're really eager to be successful with this, sometimes more eager than day one allows in terms of success. So your knowledge and your attitude goes a long way as far as supporting and encouraging them. And just remember your role as a nurse, especially in this setting, it really does make a difference to their breastfeeding success. And our last slide is just a thank you. Thank you for all you do. No matter what group you work in here in the Birth Center, you touch breastfeeding families. So everything that you do to support them, thank you for that. And if you need any more information or want to work with us more closely to see, some positioning techniques or things, just reach out to one of the Birth Center lactation consultants. Thank you very much for listening.